If you've ever been told that exercising during pregnancy is dangerous, or maybe you've been told that you shouldn't lift anything over 20 pounds, I hear these myths all the time being told to pregnant women, especially newly pregnant women. And while they are coming from a really good place of wanting the new mom to feel healthy and good in her pregnancy, it can be really scary and honestly, sometimes dangerous advice. But here's the truth. Staying active during pregnancy is not necessarily just safe, but it's actually beneficial for your pregnancy, for both you and your baby. So today, we're going to debunk the top 5 myths about exercising during pregnancy. The first myth is that exercising, especially during your first trimester, may cause miscarriage. And that honestly is just not true. I understand where it comes from. Potentially in the past, they thought that maybe too strenuous of exercise might harm your baby, or that pregnancy in general is really fragile. But time and time again, research has shown that exercise does not cause miscarriage. In fact, the contrary is true. Moderate intensity exercise, especially during your first trimester, can benefit you, especially improving blood flow, placental health, and overall pregnancy outcomes. So unless you've been given any sort of medical advice or have been diagnosed with a medical contraindication to exercise during pregnancy, you are typically fine to continue with your previous routine and maybe even start exercising for the very first time during pregnancy, so long as you are working with a provider or you're under the guidance of a pelvic floor physical therapist or a personal trainer who specializes in working with women during pregnancy and postpartum. Myth number 2, you shouldn't lift weights during pregnancy. This kind of goes along with myth number 1 of exercise causing miscarriage, in the belief that they used to think that pregnant women were just a lot more fragile than they actually are. In reality, your body is a lot stronger during pregnancy than you give it credit for. And so long as you are lifting with proper form and exercise progressions, you are good to continue strength training during pregnancy. I mean, think about it. During motherhood, you're going to spend so much time lifting car seats, lifting strollers out of your trunk, carrying a baby in one hand and groceries in the other hand, and you need to be strong in order to do all of these things. So the stronger that you can get during pregnancy will only help your postpartum recovery, and it'll also just help you enjoy motherhood without the aches and pains and feeling like you can't do everything you want. Myth number 3, you shouldn't elevate your heart rate above 140 beats per minute while you're exercising. This is an outdated exercise guideline from around the 1980s, where they said that you shouldn't elevate your heart rate above 140 beats per minute because it may be unsafe to you or your baby. But the reality is your heart rate automatically elevates just from a resting standpoint because you're pumping more blood through your body. So instead of looking at the actual numbers for your heart rate, the current guidelines recommend going by the rate of perceived exertion. And honestly, the easiest way to determine how intense you are exercising is with the talk test. Meaning, can you carry on a conversation, maybe taking small bits of rest to catch your breath while exercising? So if you can maintain a conversation with just a few moments of rest while you're exercising, then likely the intensity of the exercise you're performing is totally fine and within safe limits. Myth number 4, all core work is completely off limits. Many women are taught to avoid strengthening their core during pregnancy in order to prevent diastasis recti, or maybe they're just fearful of developing diastasis recti during pregnancy. And for those who don't know what diastasis recti is, it is when you have a separation in your abdominals, specifically that big 6 or 8 pack muscle. And so yes, you do need to modify your core work during pregnancy, but you definitely should not completely eliminate it. In fact, if you weren't performing core strengthening exercises prior to pregnancy, I highly recommend you start now, so long as you are able to perform the movement without any sort of protrusion at the midline of your abdominals, which is called coning. You need a strong core in order to prevent and reduce low back pain during pregnancy, SI joint pain, and maybe pubic symphysis pain. Having a strong core is really going to help keep your body in a place where you're not experiencing significant pain throughout pregnancy. The most important muscle to work for core strengthening during pregnancy is called your transverse abdominis muscle. I like to call this muscle sort of like your corset muscle because when you engage it, the muscle acts as a corset and cinches everything inwards towards your spine, which helps provide more stability throughout everyday movements. So no, core work is not canceled. It just needs to be modified and done with purpose. And myth number 5, you cannot lay completely flat on your back at any point during pregnancy. Now, the reason for the caution about prolonged periods of time flat on your back during pregnancy is because after about 28 weeks, your uterus and your baby are growing. And when you lay flat on your back, you can potentially compress your inferior vena cava, which is really just an important vein that returns blood from your lower body and your abdomen to your heart. Now, if you were to spend hours on your back, then you might experience this inferior vena cava compression by experiencing dizziness or nausea or lightheadedness. But if you're just performing one set of an exercise, for instance, a chest press on your back on the ground, if you're just performing this for about 12 reps or so and not for hours on end, then likely you are fine. The other thing to know is that your body will tell you if you need to move. If you're laying on your back and you begin experiencing this compression of this major blood vessel, your body will physically tell you, hey, I need to roll to the side to reduce that pressure, because you will start feeling lightheaded and dizzy and nausea, and you won't be able to continue the movement. So if you're performing an exercise program during pregnancy and it has 1 or 2 exercises on your back for a very short period of time, there is no need to worry. Just take note of those symptoms. Pregnancy really is such a transformative season, and you deserve to feel strong and confident and empowered with your movement, not fearful. That is why, as a pelvic floor physical therapist and mom of 2 and soon to be 3, I developed my Moving Through Pregnancy program, which is a 37-week prenatal strength training program with fully guided classes, so you don't have to worry about what you should or what you shouldn't do, what is safe or what is not safe, and you can find that link in the description below. If you found this video helpful, make sure you subscribe below for more pregnancy, postpartum, and pelvic floor education.